This red. Because right now this red means it's recording. There you go. Now it's broadcasting. It was Ross.
Little.
All right, here we go in 3, 2, 1. What's up, y'all? Welcome back to the Sports Medicine Broadcast live at the Memorial Hermann Sports Medicine Update. Chris Shields, again, talking about concussion, return to play, some vestibular therapy type stuff, all the different things that they're doing there. Again, he was on the Sports Medicine Broadcast way back, same time as Dr. Hutt, so you could search the website there. I'm also joined by a second-year MAT student from the University of Houston, Ross Little. So Ross got quite a few questions for Chris. Again, this is sportsmedicinebroadcast.com/shield2018. This episode will be sportsmedicinebroadcast.com/shield2018. And so without much further ado, Ross, take it away.
Appreciate it. Excited to be here. So, Chris, in your talk, you talked a lot about the different kinds of rehab that you're doing for concussion. Can you discuss just a little bit on the importance of specifically the vestibular rehab in your concussion rehabilitation?
Yeah, so typically after concussion, what happens is a lot of folks have vestibular issues, right? So when we talk about vestibular, usually we're meaning there's some dizziness that happens after the concussion or some visual components. So they have some visual sensitivity where they can't seem to focus well on objects as they move their head, or they have a lot of dizziness that comes about when they ride in the car or go into a busy store because their brain can't process that visual information anymore.
Great, awesome. And so we see, or I guess there's an old way, and we see now that concussions are kind of on the forefront of sports medicine with as much as the media is putting onto it. We see an old way of when an athlete has a concussion, you kind of discuss, let's shut them down, lock them down, put them in a dark room, have them kind of just go through that progression. And the new way now seems to be getting them into rehabilitation, monitoring those symptoms, and then, as you said, going into more of an aerobic progression as well. So what changed from that?
Well, we started realizing that people were having maybe some detrimental effects, in terms of their psyche and also in terms of, physically, they're having deconditioning happening big time, especially if an athlete that you have working out, multiple times a day, every day, and then you say you can't do anything at all. You get a lot of deconditioning to happen, right? But then also on top of that, working out and exercising is part of who they are, and they relate to that, and you're taking away a huge part of them if they can't. So emotionally, it helps them as well, because there's a lot of emotional components to concussion, right? You get a lot of irritability and sleeplessness and some emotional symptoms. So this is one way, to push them into that aerobic protocol. It's one way to kind of push them a little bit more, a little bit sooner, and give them some semblance of exercise so that it kind of helps them physically and emotionally.
Awesome. And so kind of diving a little bit deeper into the different rehabilitations and ways of rehabilitating after post-concussion. We see kind of in muscular rehab sometimes, if someone has any muscular imbalances or asymmetries, we see kind of helping them train neuromuscularly by pushing them into that deficit and allowing the body to kind of retrain itself. You discussed a little bit about kind of pushing into the dizziness when doing vestibular rehab. Can we talk a little bit more about that as well?
Yeah, so the system, a lot of times with concussion, the dizziness is not even a result of the system, a certain reflex or certain component not working. It's more kind of the overall of how well does the brain take 1 and 2 and 3 and 4 different systems and integrate them back in, right? And so unfortunately, when you have a concussion, the vestibular and the visual systems are very well integrated into the brain, right, and with each other. So a lot of times you see deficits with those. So yeah, if you can manage the headache and not push into that, then what we do is to get dizziness better, you push into it, right? So like Todd was saying in the talk, if you have a weak bicep, you're going to lift heavy weight to make the muscle strain and stress, and then the muscle and the nerves are going to react and get stronger, right? The same way with the vestibular system. If you don't give an error signal to the brain, which in this case is the dizziness, then the vestibular system is going to stay where you are. And that's what happens a lot of times in folks that don't come to PT is they'll have that dizziness and they just end up learning how to avoid getting dizzy, and they never fix the problem. So then when they still, occasionally move their head real fast, they get dizzy. And it's like, oh, well, let me help you train that, right? So we pull them in and we push them into that symptom, right? specifically, and again, I try, if you're looking at a 0 to 10 scale, I try and get them up to a 4 or 5 out of 10 with dizziness exercises or vestibular exercises. And by doing that, it will slowly, sometimes quickly, cause the brain to make changes, and then you have much less dizziness or no dizziness.
And so have you seen, almost since you've been trying to do or been doing that, implementing it more, have you seen more success, or have you seen kind of maybe, like you said, a faster progression in their rehab, or
since we started implementing
the pushing into the dizziness?
Well, yeah, so you typically see that. I mean, if folks are having a lot of symptoms and they're not being treated appropriately, then yeah, they're probably going to progress much more slowly, right? So once you start introducing these, the dizziness typically goes away. When you look at the symptoms related to concussion, you have a lot of dizziness stuff. There's some emotional and behavioral things. There's a lot of cognitive components, and then there's like that aerobic part. So the dizziness and the aerobic we can treat with PT and usually help those get better. The cognitive part we can help with a little bit by doing some dual task components, and that helps things get better. But really, there's sometimes with the headache and the cognitive component, there's not a lot that PT can do. But the way I view it is that if we take out 2 of the 4 symptoms, then there's more available brain to focus on healing those last 2 symptoms. So my goal is almost always to get the dizziness gone, because it's the easiest to get rid of, really, right? The brain responds extremely well to these exercises, right? I actually only had 1 patient who I'm currently seeing right now that has not responded well. And unfortunately, we're pushing him into the right stuff and his brain's not changing. But traditionally, very, very good results from the vestibular rehab in treating the dizziness. And I mean, that's even folks when I was at Tears seeing some chronic, brain injury stuff, like 1 to 2 years out, you're still going to see progression. Maybe a little slow with those guys. But.
Okay. And then there's a couple more questions here, but so when you have different athletes, different people come from different worlds in terms of competitive sports. You have athletes in football getting concussions, soccer, male versus female. How do you adapt your rehabilitation to fit those, to fit them back into their own competitive sports?
Yeah, I mean, I think a lot of it comes from just the initial assessment. So you assess them, and most concussion folks are going to present differently, right? So even when you're looking male football player to male football player, but definitely when you go from male football player to female soccer player, right? So a lot of times, research is showing the females are showing longer recovery times and possibly more easy to concuss them. And so, a lot of times depending on what you find. So, I mean, my evaluation is what really guides me. But then also knowing which sport they're going back to. So for a lot of my athletes that show tons of cervical weakness, I'm going to do a lot more cervical strengthening with them, right? I tend to do that a lot more with a lot of my female athletes because I find a lot of like the soccer and volleyball girls, they just don't seem to have a lot of that cervical training in their wheelhouse, and I think it's not really pushed in a lot of different sports, but I mean, a lot of football players will come in with thicker necks, sometimes thick necks, but weak stabilizers underneath. So I still have to work on it with them. So it's not just exclusive to females, but I think by far we see that they have some of the weaker necks, and unfortunately, from statistics, are maybe having more concussions and more prolonged recovery. So I think it's important to work on that with them. But yeah, in terms of the sport, just depending on what sport it is, towards the end of rehab, I'll try and get the system working better as a whole, and then I'll start doing a little bit of agility mixed in with some vestibular-based exercises that are specific to their specific sport. But that's kind of where I'm also working with the trainer and saying, hey, what do I need to do here, or here's what I need y'all to do, because I don't really do return to sport, right? I do the concussion rehab in the clinic, and then I'll kick them back to you. But I try and do a little phase of that agility before they kind of get sent back to the training room, because a lot of times they have no symptoms, and then you'll send them in some higher interval stuff on the agility, and right away they're getting headaches and symptoms, and even sometimes dizziness. So if that's the case, then I'll try and push them into that a little bit more.
Okay. And then just lastly, I just kind of wanted to touch on the home side of the rehab. We talked about setting up HEPs or home exercise programs for your athletes, for your patients. How much of the rehab are you having them do at home? I know the purpose of doing home exercise programs is you can progress more in the clinic, do more, and there's things they can do at home. But how much are you having them do at home while they're away from you or away from the clinic?
Yeah, it's most of the rehab, honestly, especially with these athletes. if they're not doing the daily aerobic progression, if they're not doing the 3 times to 5 times a day vestibular exercises, then they're not going to get better, right? I could see them every day, but if that's all they do every day and they don't do anything else at home, it's still not enough, right? So vestibular wise, you need plenty of input to the brain to say, this isn't working well, we need to change. You get that, then you're going to see that good change. And usually I'll be able to tell, right? Because if I send them home with a VOR exercise, right, that's the eye exercise we give them. If I send them home with that, and it's pretty clear symptoms that should get better with that, they should be better within a week, right? Maybe not fully, but they should be well progressed. If they're not, then I know they're not doing it with them. So, but yeah, the home exercise is crucial to getting better with this population.
And any way any specific way that you've seen to kind of increase compliance with that?
I think you just educate them, right? I mean, a lot of it, especially athletes, it's pretty easy because you just say, look, do you want to go back to play, right? And if they want to play again, I mean, pretty much the doctor's going to look to me for a check off on vestibular symptoms and some of the aerobic stuff, make sure they don't have headaches with different things. And so if they don't push into it, then they're not going to get that check off from me, and they're not going to get better, and they're not going to get into play as quickly as they want. So I think it's easier with athletes, right? It gets a little harder with some other folks to have. Or if it's, the athlete that maybe has already been told they're not going to play anymore that year, those folks get a little bit harder because they don't really have the motivation. I don't care. I'm not going to play anyways, But then I just try and rephrase it into, well, how do we get them back into play the very next year, right? How do we get you back into where you can really push hard, get back into the off-season workouts? So.
Great. Thanks, Chris. I appreciate it.
No problem.